Secretary, the directors and the chief executives of parastatals here present, would I call you executive president, the president, and other distinguished members of your team, the Honourable Minister, I want to thank you very much for keeping time to be here with us. I don't need to ask you how is the strike going on. I have been feeling the torches, and I know it is going on. Be that as it may, I just decided to call you to this meeting together with the minister so that we can see how we can move forward. The last time I called you here, we had some exchange of ideas, and I allowed you to go and see the minister. But from that meeting, none of you bothered to come and tell me why you were. I just heard you going to the streets, you are going on strike. You have every right to go on strike, but I have always said that going on strike is not the best thing to do. But if you think that your doors have been shut out, we should have. You should tell us that these are your problems. We know the problems, and I believe from what I have seen, you have quite a number of issues that you can take home. But I don't know the issues, the problems of Mr. President. He doesn't want to talk about the few things that we are able to give him. But let it be said, whatever one is looking for, you cannot claim that you have to get 100% or 90% of what you are looking for, because you cannot get that 100% that you are looking for at a go. Maybe with time and patience, you can definitely achieve your target. So, Mr. President, I want to hear from you. Why are you going on strike, in spite of the few things that you have been able to do?
Thank you very much.
Why are you going on strike? We have the list of the catalogue of the issues that are under discussion, but I think what you are having there will be adequate enough to convince your members that you are achieving something. And please tell us, why are you going on strike? And because of the issues that we have discussed with you and the few that you are able to get, I don't know whether you have been able to get something, and I believe you have been able to get something. So please tell us, you have the list.
The national extended, the national negotiation team, and the National Strike Monitoring Committee. It is widely accepted, it is not a Suleiman's prerogative, sir, that not enough has been done.
When you are president, you have executive powers, you have so many powers.
I report to the Honourable Minister that not 60% of our members have seen the alerts, as I'm talking to you now. With respect to the accompaniment allowance, as at yesterday, I don't know about this morning, IPPIS is yet to receive the 6 billion. The 2.9 for accompaniment, the 2.4 for non-clinical duty for consultants, and the 400 million for JSU members. At least it's the 2.9 that affects NARD. All the others. In fact, out of that 2.9, just about 500 million will come to NARD. In fact, we were even in the office yesterday, the IBPS and Dr. John's office, thinking maybe the money has been moved so that we begin to alleviate here that this one too is coming. It has not yet been moved. In our conversation last week with the Ministry of Health, there's a number of issues that came up in that conversation. Not all of them have a satisfactory outcome. With respect to the professional allowance table, the Ministry of Health made it very clear that that table will not be released.
Which one?
The professional allowance table.
You don't have the list?
No, I don't have this document. Yes, sir. 25-35% have given us a summary. Number 2 is the accoutrement allowance. Have given us the state of things now. For the unconditional reinstatement of our members in FTA locally, what is on the table now is that 3 who did not go through a proper disciplinary process can be reabsorbed to other teaching hospitals except FTA locally, for which that falls short of the minimum threshold required by NARD. For the other 2, I understand yesterday a committee was inaugurated. NARD had requested to put in a representative in that committee. The board chairman is heading it, and somebody from Human Resources in the Ministry of Health is in that committee, and Professor Tobo, the negotiator that was appointed by the Ministry of Health, will advise that committee. We had requested that NARD be given, even if it's an observer status in that committee, was to have a person that will be there when some of these conversations are taking place. He's not going to be the president. In fact, I can guarantee you it will not be anybody near the NOC, the extended NOC, strike monitoring, or the national negotiation team. We are yet to get a feedback on that.
So it can be the president.
No, sir. No, sir. It is the first we are hearing of this, so we will make 2 observers available. And it is our hope that at the end of that, those other 3 would be absorbed back to Lokoja, and then we wait for this committee within a reasonable time frame. In our conversation with the Ministry of Health, 1 month was being quoted, even though it was clear the minister said they could finish their work in less than 1 month. We would hope that it will be in less than that. Far significantly.
Let us discuss item number 3. You are saying that we have agreed to allow those 3 doctors who have not gone through the normal process of disciplinary, that they are going to be posted back to their duty, but because of the university, we have decided to take them to other medical institutions. Am I correct?
Yes, sir, that is what is on the table.
Okay, that's good. So you are saying it's not acceptable to you, or
you would like them to go back to Lokoja? These people are married, they have families, they have children in school and all that.
no.
That is the demand from the National Executive Council. It is not.
But it should be a reasonable demand now because of these issues. It's even better for them to go to a place where they can live better with the management. I think this is, and they don't have the choice. We can post them anywhere as our staff.
You know, sir, because they didn't go through a proper disciplinary process. We would have, even from the beginning, told them go and apply for job elsewhere because they were terminated, they were not dismissed. The National Executive Council looked at it, and the requirement is that they go back to the hospital. For me, I cannot cross what the National Executive Council has said. That is why we are pushing. It makes life a whole lot easier for everyone. Nobody is comfortable that the strike is going on. Nobody is.
So you see, you are comfortable now. You are comfortable. You are not going to the office. And you are also preventing others from going to the office. There is a monitoring committee on this. So but the issue is, if you are our employer, you have the right to tell you go there and work or go there and work. You don't choose for us. We are the ones to decide where you go. I hope you understand that. These people have made some mistakes, and we realize that because of what is on the ground now, we can show our faces the other side, and we absorb them. But what we are saying, we cannot absorb them in complete because of the sour relationship that is already fuming. So let them choose a place of their choice. You can take them there.
Sir, I don't want to, and I made this clear from the beginning, I don't want to litigate the matter because it is not for me to litigate.
That is why I'm saying you are an executive president, you have a lot of powers, particularly you and the executive, you are here. Hold on. You see, if you cannot take these simple decisions, then there is no point we meet. You have to take decisions. We are giving you the exact reality of the situation on the ground. You cannot be dictating why you people are going to be hosted. It's not done anywhere. So consider this and appreciate the gesture that we have so far offered. And disciplinary issues, particularly in your field study, are very, very important. And we need to monitor this.
Thank you very much for the gesture. Mine is that this individual were employed to replicate Lokoja, and there are not categories of staff that can be posted out, but within the hospitals, they can be moved from one department to another. But moving them out of that facility is not the engagement that they were getting that was handed over to them. And it has not been established that these terminations, they are truly wrong. But we are looking for a way to resolve this matter. And the mandate given to us is that these people should be reabsorbed in this facility. And we cannot be able to go back to tell these people that if these people are not reabsorbed into this facility, we can guarantee for the situation to be resolved. If it's a civil servant and it's somebody like it can be moved from one state to another, that one is called, for example, I'm Pesina now. You cannot just move me out of Pesina to another state. But if it's somebody that is working as a civil servant that has that peculiarity, can be moved out. These people have a family input. If we are moving them out now, are we going to take care of their accommodation? Are we going to take care of their children's fees? And the resources they are getting monthly is not even enough for them. So how can we get additional resources for them to take care of all these things? These are the things we are looking at.
Sorry, Minister, maybe I should just provide some information based on the report from the management of Lokoja. Unfortunately, we should have invited somebody from Lokoja to be here. But the report here is that the three people involved, Dr. Santi Dola, Dr. Noel Omada, two of them were local staff of Lokoja. That means they were temporary staff by the report here. And from what we've been told and the letter that we've been shown, Lokoja was using a 4-month engagement with the new local staff. It does not mean that we agree with the 4-month engagement, but that was the understanding between them and the management of Lokoja. So, if they are local staff, it means that Lokoja initial is not their permanent employer, because it means that at any point in time, Lokoja will say we no longer take medical staff, which I think is what happened in this case. What we are told is that the hospital refused to renew their engagement. That's for the two. For the third, who is Akibode, the report that we have been given is that he voluntarily resigned his appointment from the hospital. So that is his two reports that we have given. So taking all this together and listening to the side of the management and the side of NARD, we as government felt that both sides need to be taken into consideration in such a manner that we do not solve one problem and we walk a little forward and then another issue is created. So the Minister of Health at the management level therefore felt that, look, these three people, if they are still a commissioner, because they may say they are no longer interested in working with the federal government. It's very possible. I don't know whether because they have not communicated whether they are, although I just asked them to write formally to them yesterday. So they are going to be informed formally that if they are still interested in working for the federal government, they can apply to any hospital of their choice apart from Lokoja, and then they will be taken. That is the decision that came from the Minister of Health. And that decision is based on those circumstances that I've explained. Thank you.
Thank you.
So that they will explain to the federal government why they employ people, and they should show us. I have a copy of the local appointment. So let's dig into that. You renew people, senior staff, every 4 months with bogus and very unclear, very ambiguous and very archaic rules, where people cannot even get leave. People don't even have freedom to associate, and you call that employment. I am ashamed that we are at a table with the federal government and backing what those chief executives did in that center. In Sena clients.
No, you need to correct that. And please mind your language, Mr. President. I said it clearly that it does not mean that we support the 4 months agreement. I said it clearly. But that was the understanding they had with Lokoja. It didn't involve the Minister of Health when they had that understanding. I mentioned it.
So in that case, sir, whatever the management is submitting, they are also a party to this. Whatever the hospital, not the ministry, the hospital. Whatever the hospital is submitting, it means they are also a party to this. They are a party to the crisis. They can't come and submit a report that we have not even had a right to see and give our own perspective of what they are saying. And then that will now be taken into cognizance in resolving this matter.
This is before you now, and it's for you to either say no or yes to it. It's before you are telling you what happened. And we are not saying that what they did is also correct. And that is why we are saying what the whole process was not done very well. And on the side of the two of them, both the workers and the employer. So we are now giving the employer the opportunity to reabsorb themselves in the place of his choice under a condition that he so chooses to be.
Thank you very much, sir. Once again, if you see the query that was issued to these gentle colleagues, it ranges from why did you embark on strike? We see the way we did now. We came up with a demand and it was presented to management. And they also presented the same issues to management, with their demand ranging from fall leave, lack of staff, people taking longer time without being considered for employment. And when there is no response, the management, they went for protest and they embarked on strike. These are the issues that was, the query that was issued to them. These are the contents. And for now, these are union leaders. These three people we are talking about, they are either vice president, secretary, or financial secretary. Does it mean that we now, that are national officers of this association as a NARD, we are demanding that this issue should be resolved. The Ministry of Health will now issue a query to us and said we cannot go back to our institution, Christina, that we have to be posted out of the country because of this. So we see these issues as a union matter. And our appeal is that these guys, they presented their case as a demand for the genuine reason that they have been affecting the issue of manpower, where you have in the hospital for more than 120, you are currently having 32, and you have the conductor almost 89. So these are the issues they presented. Employ more, we are dying. And they said, why did you go and protest? Why did you go for strike? So because of that, we now said these union leaders, after fighting or trying to fight for this to be resolved, they should not go back to the institution. These are our questions, sir. We want this Honourable House to kindly reconsider this position so that everybody will be feeling that they receive justice. Thank you very much.
The termination letter, sir, contains in it, you are being terminated because of unauthorized protest. That's what the termination letter says. Unauthorized protest, because they protested some of these things. Which is why it's difficult to take this back to the National Executive Council. But if this is an unshakable position from the government, it's not difficult for us to go back to the National Executive Council and present it. It's not.
You see, Honourable Minister, I think you will recall when we were talking on the phone last time, I told you that we cannot ferry people just because they are going on strike. It is an inalienable right to go on strike and to ventilate their views on issues affecting their welfare. And I think I made this very clear to the ministry, and this is what we are maintaining. And I also didn't know that these people are leaders of the association in the polytechnic or in the teaching hospital. We usually don't allow leaders of unions in their places of work to be deployed somewhere else just because of one reason or another, particularly because of strike. So, but having said this, I want us to just note this and see how we can go around it so that we make progress. The Honourable Minister is going somewhere else. He has a very busy schedule. I just insisted that he has to be here. We will look at this again and see how we can go about it. But definitely you will agree with me that the relationship between that institution and these people we are talking about is at the moment very sour. We'll look at it later. Let's go to item number 4.
The Federal Ministry of Health and Social Welfare immediately constituted a task force to develop and implement a clear and humane working hour policy for doctors practicing in Nigeria in line with international best practice to safeguard both physician well-being and patient safety. When we had our conversation last week, Thursday, with the Honourable Minister of State and some officers of the Ministry of Health, it was a unanimous decision that call limits be limited to just 1 day, after which the officer should go and take a rest. And I believe after that, the committee of CMDs were asked to advise on how to move forward on that. We had also asked that a task force be set up so that beyond just saying take call for 24 hours and go and rest, what is the framework moving forward so that we ensure that patients are covered 24 hours? Because our numbers are inadequate. We know, we appreciate that. Our numbers are inadequate to say, take one call, go and rest, come back and continue work. And then there might be gaps. The Honourable Minister made a very valid, passionate point that all of us appreciated, that the entire workforce of every hospital should be looked at in terms of developing that. We don't know the position of the ministry as yet with respect to setting up that task force that will look at it more holistically And we're expecting at least a written communication or something on paper that says those hospitals should go and make sure that officers that take calls after 24 hours should go and rest before coming back. Now, the implication of that, for those of us that probably are part of this conversation for the first time, is straightforward, and we agree with the Honourable Minister on this one. The numbers are inadequate. The population is exploding. My treasurer, for instance, is the only senior registrar in that plastic surgery unit in FTH Lokoja. Since February, he has been the only person on call. It is not tenable. He is likely to make mistakes. He is likely to make errors that will cost somebody his life. So patients are not safe in the hands of these our colleagues. We are asking that at this conciliation, let that task force, while we agree that after 24 hours go and rest, let that task force come up that will look at this issue more holistically and use the entire workforce that is in the hospital. Take for instance this FTH Lokoja, 89 consultants.
What are you saying? Let's take off. You have agreed to set it up. It's going to take off. Honourable Minister.
Oh, okay, I'm actually here.
I think one other thing that the President missed out is that we also agree that these issues sometimes are hospital specific. It varies from institution to institution. For example, the MD of Kefi was at our meeting and he told us clearly that he doesn't have a similar challenge in his hospital. And that's why we said, okay, let the CMDs and the MDs go and have a meeting and give them a directive that they need to work out a situation where every doctor is optimally utilized. Whether medical officer, whether resident, whether consultant. So we told them that every doctor employed in your hospital should be optimally utilized, such that nobody is overworked. So each hospital is now expected to go back and work that out and submit to the ministry. Because issuing a blanket from the ministry when we are not the people on ground may not be the ideal way to go. And I also know that in some departments, more than 24 hours weekend call, which is more than 24 hours, happens. So if you now say nobody should take more than 24 hours call, we have not taken into cognizance the contextual, the peculiarities in each facility. So the decision that were pushed to the CMDs and they have met over it, I asked them to send the resolution of their meeting. I don't know whether they did. So they have met over it and they have agreed that they are going to work out a mechanism to ensure that every doctor is optimally utilized in the hospital.
And from what I'm seeing, we are talking about item number 4, prolonged work and full duty hours. So this can, from what is there on ground, you can see that it is not something that you can achieve today or tomorrow. I think it requires an arrangement. It requires a process for you to achieve it.
For our members, sir?
Yes.
And no, that's the, sorry sir, that's the Honourable Minister, that's the point I wanted to make. For our members, it's no longer acceptable to take calls beyond 24 hours. That is what NARD is saying. It's not acceptable. Now, we can talk about the specificities of each center. How many are there? There are a handful. The mono centers, like FMC, Kefi, or Dash Lafia, that just came up new, FTH Lafia. These are new, these are hospitals that are coming up and recently did employments that they were able to attract people. The Honourable Minister explained to us different waivers from different hospitals. They have still not found these doctors. So this is a few examples that we can bring out, and I can add more. There are few. They are not the generality of what, it is not in any way contextualizing the generality of what happens. That is why we are asking the Ministry of Health. In fact, we even said, even if it's an advice, because this is how call rosters are made. A chief resident, who is it? And as a doctor, anyway, let me share. A chief resident who is a doctor draws it up. A resident coordinator, postgraduate coordinator, looks at it. Who is a doctor? The HOD, who is a doctor, looks at it and approves it. The CMAC and the MD or CMD of that hospital empowers them to go ahead and implement it. It is a doctor's cycle. You know, the implication of allowing hospitals to do it on their own is, okay, you're going for exams, you are the one causing problem. Okay, we'll see how you come and go for the exams. It happens. That is why we're asking the parent ministry to give an advice that leaders in that hospital can hold on to something. It won't just be that they said with the mouth. Leaders can hold on to something to engage their management. Otherwise, it will be your time to go for exam. Somebody will tell you, Shebi, you're not taking calls. It happens. I mean, our senior colleagues who are at this table know. In fact, that day, our able chief, the deputy registrar from MDCN, even cited MDCN regulations that should naturally self-correct these things. But it cannot happen like that because nobody is there to look at those chiefs when they are taking those decisions. Which is why we are asking that such an advisory note come, such a task force from the Prime Ministry of Health comes, where all stakeholders, NARD, Committee of CMDs, Ministry of Health, who can sit down and look at how it can be made something more of a long term, more there. But for now, limit those calls.
So, in other words, are you calling for intervention from the Ministry of Health to set up a kind of task force?
Yes, sir.
To go around the hospitals,
yes, sir,
see things by themselves, and try to correct all the anomalies that are there. I think this makes some sense. But the issue is, we don't want you to tell us that you cannot go back to work until that process is finished. I don't think it's reasonable.
In fact, sir, that's not what we are saying is that advisory note comes now.
No, but
then the task
what
force
you are saying, that is saying they cannot accept anything beyond 24 hours.
Okay. If I talk more about that framework,
no, what I'm saying,
this is just one aspect of an initial conversation. When you limit that call to 24 hours, for instance, there's a question of how many hours does a doctor even give per week? There's a question of how are the numbers used to structure that call per week? There's a question of if that doctor is required to give extra hours, what happens? So it's a long, the first step is just to say limit the call. There are other steps that we acknowledge that time with that task force can take care of all of that. But as an initial step, let this advisory recommendation come from Ministry of Health to tell those hospitals that these people can no longer do this, so that the other conversation can take the necessary time it needs for a resolution to take place.
I think the Ministry of Health has said this very clearly and very loud too. They have engaged the CMDs on this matter, and I think everybody understands the fact that you people are being overworked. So what do you ask?
It's part of the resolution of this year.
Yes.
So I'll ask them before it. They have met.
No, but Honourable Minister, what we are saying, let us have a kind of, would I call it implementation committee or a monitoring committee that will look at these things holistically across all the medical centers to ensure that these things are being done. But by the time you limit it to individual CMDs, yes, everybody will be himself and will be doing what is correct for him. If we have a central task force committee, maybe it will monitor these things better.
Yeah, it's good.
Okay. Is this okay for you? Yeah? How we are not going to tell you, will go back and tell them this is what you have agreed. And no, you see, we want to carry you along. But some of you are not fully conversant with these things. Huh? So please, I hope it is acceptable to you now.
Yes, sir. That is why we have a large contingent here today. Everybody can. In fact, the second vice president just came.
So if you are so reluctant like that, you have to take some steps to be in charge sometimes. Take cognizance of the membership of your council, and also take note of the rich experiences that you have. that will guide you in taking some of these decisions. And also take note of the period that is available to you to be an executive chairman, an executive president within the short period. I think what we have agreed now is should be said to be okay. Don't say yes, sir. Consult them if it is okay.
You will think of that, sir. This timeline.
We will come to this again. Timeline. Yeah? Timeline, yes, this timeline is important. Okay, give the timeline. Propose a timeline. You know the scope of the job. Yeah? You know the hospitals we have.
For the advisory recommendation from the Ministry of Health, it should be immediate. For the task force, I think something between a month and 2 to round up is quite acceptable to now.
This task force, you will be part of it. So, whatever time you give, we will take it. What we are going to achieve within the timeline.
First, we've given the advice. Like I said, the CMDs have met. They have reached a resolution which captures the advice because we don't want to run their hospitals for them. So, and that's advisory or that's a resolution which is forwarded to you as members. So that's
we are talking about the task force.
On the task force, yes, we'll go back and then look at how we do.
I want us to carry this together so that we don't have to come back again on this matter. Let's give some timeline.
No, you have to suggest.
Yes.
And I'm happy what you said with it. I suggested 2 months maximum, and you said it's going to be part of it. So now it's part of it. So they will see now. Whether they can be achieved in 2 months or not.
Yes.
They will see now. We have 78 federal teaching hospitals spread across. So they will see whether it can be achieved in 4 months. So if it can be achieved, they will also see. So I don't think that timeline is agreed.
Okay, do we take 2 months?
Yes, it's about manpower and recruitment. Currently, the waiver system is being employed. I'm sure a lot of waivers have been given. There's about 30 waivers that we're aware of different hospitals to employ different cadre of workers, and we're happy that about 70% of that, or even more, is usually clinical staff. The challenge is that before waivers come, the concentration aggregates of doctors that are interested in residency training slots disperse. Some leave the country, some pick up work somewhere, some go to NGOs, and then that number disperses, which is why we are suggesting a 1-for-1 replacement policy. This was discussed quite a number of years ago, where it was, in fact, at a point it was agreed upon. The challenge was how you monitor the chief executives not to abuse the system. That was the challenge. And then we suggested that the Ministry of Health can set up a desk office whose responsibility is to liaise with key government agencies that are involved in this employment, so that anyone that leaves, for instance, as an SR1, I will write part 2 exams, I will have to exit residency. It's either I'm given an employment as a consultant, or 6 months later, or however the hospital deems fit, I am let go. That slot remains there for the rest of the year with its budgetary allocation. Replacing it with another officer, who at that point someone can make a call and bring in someone, makes life a whole lot easier for that hospital. You have lost one, you have replaced it with one, which is what we are suggesting. When we met with our Oga last week in the ministry, there were about 30 waivers. In fact, he had all the files, and some of them had quite substantial numbers to employ, but they are simply adding these jobs. Even if they are there, they don't pick up these jobs. Because before time will come in the process, you eventually, and we commended them, even my previous administration commended them in shortening the period within which those waivers are produced. But even within a month, 2-3 months, these doctors disperse. So we are asking if that 1-for-1 can also be, if the ministry can be given that authority, to guide and supervise it. It makes life a whole lot easier. Now, some JAPA, even while they are working. So for instance, people who JAPA, like in my own department, I know of 2 people that passed the exams and left. And those 2 slots are just there, and we have to wait for the next waiver. And then there's a clear budgetary line for those personnel for the rest of the year. You know, so this is what NARD is presenting on the table, if it can be considered.
I'm not sure whether this thing 1-for-1 that we are advocating for has been formally agreed to by the head of the civil service, because what they usually do is this, what do you call it, this waiver. And if Ministry of Health will make a case, a very strong one for that matter, to the Office of Health Service, they may consider it and see whether they can give you a special waiver on this 1-for-1. But the issue is you talked about also is also there, my issue of abuse. If it is given like a kind of blanket approval, the CMD can go and do what he wants with it without even you knowing. And so there are so many other cadres also in the health sector. If this is given a blanket approval, it's also subject to kind of abuse. But what is important now, we have waivers that are on ground, and I believe the ministry is committed to making the best use of these waivers. And by the time we're able to achieve this, we'll be able to reduce most of the pressure of workload there. I don't know whether you have tried to explain it to them.
Yes, we're willing to open a discussion with the Office of the Head of Service.
From this 1-to-1.
Yeah, because what we want is progress. But clearly, it is not a decision for the Federal Ministry of Health. And it's also something that needs to be well thought of. It's not something that we can hurriedly, because we have to look at all the implications and all the likely pros and cons. We should not just look at the pros. We must also sit down and look at the cons very, very well and ensure that, okay, if we implement it, it's not going to create additional problems for the system, especially the entire civil service system and even for government. So, something we're willing to alter a discussion with the head of service, because clearly the decision is not with us, it's the Office of the Head of Service of the Federation.
Just an additional point. In 2021, this was actually discussed and actually the National Assembly was in it, the Office of the Head of Service was in it, the Ministry of Health was advocating for the decision. Just that
if you have circulars that can support this, we will look at it. You have circulars? I heard about it, but I don't want to rely on it because it's just hearsay. If people have circulars that will support this, fine. It will even reduce the volume of work for the ministry.
Yes.
They don't need to go back to the head of service.
What sometimes happens, which I want our union leaders to take up. Sometimes when we put government under pressure, even things that are not implementable may be agreed with you. And then we will just go round, and then we come back.
It's not implementable.
So, and that is why we're saying this administration, anything we want to agree with the unions, we want it to be well discussed, and everybody agrees that this is something that will add value, that will not create even more problems that it is trying to solve. And that's why I've said we're willing to engage in that conversation. If there's an agreement in the past, please bring it forward. We'll look at it. But the question that we ask is, why was it not implemented? It was agreed in the past. It's a very, very important question.
If you have any document that you can help us.
I will get a document from the Secretariat and forward it. Why it wasn't implemented is simply because the head of service does not trust chief executives. That is the reason.
That's what we are saying. No, but another thing is that also, the issue is that these IPPS issues will come up again.
Yes.
Because they don't accept anything from this chief executive without a waiver. So we need to.
I told you that Federal Character will come in.
All other agencies will come in.
Those want to come in now.
Okay.
So let us understand this better and then see how we can do. If you have any document for now, bring it up so that we can take it out with the head of the civil service and we will see whether he will not renege in his
Now that we're here, sir, I can name hospitals where people left. They found their way around within the system to replace those people.
What we need is a circular that will support this process, or anything documentary to support this process, and we'll take it up with them. When we look at it, on the face of it, we can know if it is an acceptable document. If it is not, we'll go back to the head of the civil service and tell her, please, can we get this formalized? I think by the time they do so, it will be better for all of us. And nobody is interested in working doctors because we know the risks involved. It's just a matter of kind of we're in a certain stage where we have to be managing some of these things, even though they are not supposed to be done like that. We're all aware that this country, a developing country like many of the countries in Africa, and some of these things will have to work very hard to see how we can get out of it. So please don't think it's just because it is you who is here that these things are like that. You made quite a number of them on ground before you came. And it is good that we are working towards getting out of those things. And we'll be here to support you on issues that are feasible or issues that can be done. But don't forget your country, don't forget what is on ground, and try to be realistic, try to be indigenous, not just talking about what is happening in other places outside this country. We sympathize with you quite all right, and we're working very hard to ensure that these conditions are greatly improved. But you have to also understand and appreciate what government and we people here are doing to address this issue. We are not small children that will just say, no, I cannot accept this until this is done. We know the pressure of unionism, we know how it is, we all did it at one point or the other, but you should be able to navigate and to see how you can manage your situations according to what is available and what is affordable and what can be done to address some of these issues. You should be able also to tell your people that track is truth that matters. We know how some of these people are, but you should be able to do your best because you chose to be the president, or you chose to be the secretary, or you chose to be the treasurer. You should be able to lead. You should be able to take decisions, matters that are of importance to your association and that are good for your record and for the progress of your association. So do I take it that now, this 4 and 5, we have achieved some progress, Mr. President?
Yeah, yes, sir. Yes.
Yes, sir.
No, I'm looking at them. I don't want to look because
yes, yes, we will get what we have from the Secretariat and submit it and we'll take it up from there.
Okay.
Yes,
Okay.